You are listening to the Mom to Mom podcast, hosted by Stephanie Sinclair, founder and owner of How to Mom. This podcast is meant to empower women and bring the community together through storytelling and education. During these episodes, you will hear stories of triumph, heartache, and hope. You will hear time-tested tips and tricks shared by mamas and women. You will hear a variety of birth stories that will resonate with all birthing families, advice from professionals who have dedicated their teachings to pregnancy, birth, and moms. Here, you will find encouragement, support, and community, because we are your community, and we are so happy to have you. Now, on to today's episode. Hello, you guys. Thank you so much for tuning in to today's episode. I am so excited today to interview Jennifer Ingvoldstad. Jennifer is a nationally board certified bodywork therapist, abdominal therapy practitioner, CranioSacral Therapist, massage therapist, Shiatsu Therapist, birth worker, and yoga instructor. Wow. Jennifer has been in full private practice since 2003 and has also managed various wellness centers in which she created the wellness programs and services and also trained the therapists. She also taught at her school in which she graduated from, Centerpoint Massage and Shiatsu Therapy School and Clinic. Now, Jennifer has a thriving practice in the Bryn Mawr neighborhood of Minneapolis, where she first began her career in bodywork. She continues to feel most inspired by the abdominal therapy, working with those on a fertility journey during pregnancy, postpartum, those transitioning through menopause, digestive support, those on a trauma healing journey, and chronic or acute pain patterns. She frequently combines therapies in her sessions, bringing an intuitive touch to each session. Welcome, and thank you so much for joining us today, Jennifer.
Thank you. That was a really lovely introduction.
I mean, it is just impeccable, the knowledge that you have, and I want all of our listeners to know this interview would be happening regardless. However, I feel very lucky to tell you guys today that I have been on Jennifer's table, and her and I have had these conversations even with somebody who is in the birth space, where I walked in, met you that morning, and I had so many questions about this work. So much that I didn't know, so much that I still don't know. And I just think you bring a whole nother level of knowledge and how women are able to find care that they really can't find elsewhere. So we're really lucky to have you.
Oh, well, thank you. I'm happy to be here.
So if you could kind of just start and share what your journey has looked like, and what kind of brought you to this work, and, you know, how your passion kind of started in this field.
Sure. Well, I actually knew nothing about this work when I started my bodywork training and journey. So I started my massage practice, first becoming a Shiatsu practitioner. And it was as that program was winding up, I had a really wonderful business development teacher, Kim Hart, who also does this work. And at the end of that class, at our final celebration, I remember she brought in, while we were all having a potluck, she brought in this video called Sastune, which talks about now my teacher, Rosita Arvigo, apprenticing with her teacher, Donna Ponte of Central America. And she put on this video, and I just remember like all I could focus on, like I was just like soaking this up. I'd never even heard about the country of Belize. I'd never heard about this work. This all just was all new information to me. And I just remember being captivated by it. And then asking Kim some more specific information for it, and then going to see her for my own challenges. At this time, I was just seeking out a therapy for myself with painful periods, irregular periods, really severe cramping that from an early age would land me in the ER, many misdiagnoses, And through working with Kim and then also receiving acupuncture, I was able to correct all of that. And I started my then training journey again, more so just to go deeper for myself.
Mhm.
Um, I never had the intention of focusing on this therapy at all, or I had never dreamed about moving out of the country or anything. But after I was trained in this work, which I originally was trained in the U.S., both in Minneapolis and then out east with Rosita out east, my practice just became almost exclusively the Maya Abdominal Therapy overnight. So,
And quick question, when you were
yeah.
dealing with these really heavy, painful periods, trips to the ER, I think so many
Mhm.
people will be able to answer this question along with you. Were you ever introduced to this work as a potential um, answer to what you were going through?
No,
Never.
no, no. I mean, in fact, today most people do not
Yeah.
know about this work at all. Yeah,
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 exactly. Okay.
yeah.
Okay. So did you study here in Minneapolis first and then go out east or?
Yeah, so at that time, so the work itself has changed names over the years for various reasons. It's also the way that they've trained practitioners has changed over the years because they train like anybody who has a license to touch. So this is mostly like massage therapists, midwives, um, nurse practitioners. Those are most of the um, our group of practitioners that are able to train and then perform this work.
Okay.
Um, so at that time, I took my first workshop here in Minneapolis with Kim. That was just self-care. And then a year later, I studied with Rosita out east for a week-long workshop to learn the work and how to apply this to clients. And then a few years later, I traveled to Belize to become certified in the work, study the spiritual and herbal aspects of the work, and then also spend some time in Belize where this work came from. So when I went down to study, I also moved down there for a year to really just spend
Dive
time in
in.
the culture and integrate the work. Excuse me. But I loved the lifestyle in Belize so much that it just really kind of like changed my path. And I came back to the Twin Cities. That's when I did my yoga teacher certification because I also was asked quite frequently throughout that year living in Belize if I would teach yoga because people knew I practiced it. And then I came back, was certified, and then went back down and then spent the majority of the next 10 years in Belize.
Okay. Teaching and as a therapist.
Yes.
Amazing.
Yeah.
Okay. And so you really dove in. And I think kind of in the intro, we talked about that being surrounded in that nature and really
Mhm.
kind of honing in on the spiritual end of it and finding that intuition so that when
Mhm.
somebody comes to you for that therapy, obviously you have the training and the tools, but really being able to lean in I mean, would it be at all considered in line with Reiki or is that completely different?
I would say that's different. I actually haven't studied Reiki.
Yeah.
I've experienced it, and I might compare that a little bit more to craniosacral, which I
Okay.
do.
Okay.
But yeah, I'm less familiar with Reiki.
Yeah. Okay. And so then at what point did you come back to the US and start your
Oh, I kind of bounced back and forth a
okay.
bit
Okay.
because it's hard being away from home.
Yes.
And also after experiencing Caribbean winters
Yeah.
and all the long process of work permits, and now I have residency in Belize, but it was it's a lot of loops to jump through to even work in Belize
Okay.
or anywhere out of the country.
Yeah.
So I did go back and forth quite a bit. Um,
What was it like studying under being trained by and mentored by such influential therapists, like really being able to be right next to somebody? I mean, that just is a whole different level, I feel like,
Yeah,
of
it's an
training.
incredible gift. Kim Hart here in the Twin Cities is incredibly gifted. And she herself has spent a lot of time in Belize, months on end, working right next to Rosita.
Wow.
And then working with Rosita many times over the years. And her lineage being so connected to Don Eligio. And there's other healers that have influenced her work as well, but it's an absolute incredible gift.
Yeah.
And Rosita has come here to the Twin Cities. She's actually spoken at my office before, and she's also held her herbal conferences here. So she does quite a bit of work in the US, during the summer months.
Oh, I'm going to be on the lookout if that is ever another
I'll definitely keep you posted.
opportunity.
Mhm.
Yeah. So if we can dive a little bit deeper then, because you offer so many different therapies at your private practice. I know that your specialty is really the abdominal therapy, but what I was so amazed with, just from my own personal experience, is that there were other therapies incorporated in my session. And so it wasn't just focused on, well, and maybe too, we should dive in a little bit deeper of what is abdominal therapy?
Sure.
Because I think a lot of people have no idea. Maybe they've heard that term, but what exactly is that? And what are you doing when you use that therapy?
Yeah. So the abdominal therapy, and it's been called Maya Abdominal Therapy. It's been called the Arvigo techniques of Maya Abdominal Therapy. Let's see what else. Arvigo therapy. All of these therapies stem from the lineage through Don Eligio, who is Maya descent, originally from Guatemala, but the Maya, culture is throughout the Yucatan Peninsula into Guatemala, Belize, Honduras. That is the true lineage of this work. And the abdominal therapy is mostly for women, although men can receive it. And this work has kind of solidified more of a protocol and an understanding of like what's happening on a Western perspective for both men and women. But this is not just a therapy for women, although that is mostly who I treat. So the abdominal therapy, it's an abdominal massage. So I'm massaging your belly, and it's the foundation of the work is the position of the uterus. So the uterus has many ligaments, and just like other ligaments in the body, from injury or posture or anything really, like walking in heels, walking barefoot, running, all of these things that impact our uterine ligaments affect the uterus and the uterus's position. So most women have a misaligned uterus. And in the US, that is just considered normal. Where other cultures have recognized that it's optimal to be centered and upright. So that's really the foundation of this work, although the abdominal therapy encompasses the whole abdomen. So there's quite a bit of upper abdominal work that's involved, which really helps with so many things. I mean, your stomach, so digestion, diaphragm, breath. As a part of my training as well, outside of the abdominal therapy or the Maya abdominal therapy, is digestive massage. So actually like tracing the colon and the whole digestive tract, which really helps with constipation, diarrhea, irritable bowel, Crohn's, all types of digestive disorders.
All right, you guys, we're just going to take a brief break so that I can tell you all about one of How To Mom's favorite go-to brands and products. Earth Mama Organics formulates and creates organic and natural herbal pregnancy, postpartum, breastfeeding, and baby care products. We believe that they are one of the best and the safest personal care products on the market for both you and for baby. You can follow the link in our bio, or you can go to howtomom.com/links. Follow the Earth Mama Organics link and enter How To Mom for your promotional code to receive 15% off. All right, now back to today's show. Yeah, and usually these symptoms and or diagnoses are just kind of what we are given here in the United States. Like, yep, you have chronic constipation, and here are some medications that could, hopefully, maybe should, possibly on some days help you. And that like is pretty much where we are left. And that's just one example of a condition. And I know just through the conversations that you and I have had, and obviously just in general, learning about my own body and meeting a ton of women who are either trying to get pregnant or postpartum. It's so sad because that should not be the state that we are living, where it's like, yep, I just have chronic constipation or irritable bowel syndrome. And that we're just like left to deal with that. And I can even relate, as a teenager who had really, really difficult, periods and irregular periods. And at first I was just given birth control. Like, here, this is what we can give you. And nobody followed up to ask if I had still, if I was continuously on birth control for 10 years, which I really relate to my fertility issues for sure. And so that is why this therapy needs to be more well known here in the United States. And I had originally, of course, I had heard of abdominal massage many times through some amazing clients who were just much more knowledgeable than I was, even as their doula. And I kept asking questions, and I had a really bad episode last spring. And it's pretty much from all of the scar tissue I have in my abdomen from multiple surgeries. And really the only option my OB could offer me was surgery. And I'm thinking, doesn't that kind of just add to the issue? And so I was so thankful to Mercedes, who is on our team here at How To Mom, that she introduced us. And I want to talk, and I'm not sure if you start every session this way, but what was something that was new for me was the castor oil pack. The only thing I had ever really heard of castor oil before meeting you was to induce labor potentially. So can we talk a little bit about those packs? Because that was like eye-opening. And the fact that that is something that we can be doing at home is also like, why don't people know about this?
Yeah. Yep. Absolutely. In fact, as I had concluded there, I was starting to think like, oh yeah, the scar tissue, like that's such a big one for, so many women for whatever surgery it has been in your core. Scar tissue impacts the entire abdomen. And so the castor oil packs have always been a tool that we've used with abdominal therapy, but I did not start my practice using like castor oil packing in sessions. That has been newer, and that's not like a part of the protocol for the Maya Abdominal Therapy or the abdominal therapy.
Okay.
But I have found that I'm able to make such a greater impact on using the castor oil packs right before a session, because what the castor oil does is it penetrates deep into the tissue. It softens and releases adhesions. It stimulates digestion. It warms the tissue. I feel like I'm able to be so much more productive in a session. And I feel like the effects last longer as well with that. It's also something, so a castor oil pack is castor oil on top of a piece of cloth that's put right on the abdomen, and then heat is applied over it. Okay. And also castor oil is a really great, in fact, I'm recently learned that it's like one of the best carrier oils. So if you want to use another oil, like an essential oil for a particular reason, using it with castor oil will help bring that essential oil into the tissue.
Very interesting. Yeah. I feel like the only two that we really hear about is coconut oil or almond oil.
Right.
Never even considered. Yeah. And so that is something that I have continued because not only was it just a very relaxing set to kind of start the session, but you really do feel the heat and you really do feel um the softness kind of come over
Yeah.
you, which is
Yeah.
it was just mind blowing to me that I had
Yes.
never heard about that tool. So, in addition to the many therapies that you practice and also using the castor oil tool, are there other tools that you use in your sessions?
In sessions themselves,
I know
mm,
that we had kind of talked a little bit about cupping, and I know that I have referred some clients who maybe have a breech baby for the moxibustion. If you can kind of talk a little bit
mhm.
about those additional tools that you have experience with.
Sure. Yeah. So cupping therapy is a therapy I've also incorporated into sessions when applicable, sometimes on the abdomen, but more so, I would say, for upper back and neck tension, which is, super common. Actually, our whole neck, jaw, um, upper kind of trap area is a mirror image of what's happening in like our pelvic floor. And so oftentimes I will start with a castor oil pack in the belly and then start working on the neck, head, jaw, incorporating both massage, shiatsu, and craniosacral. And I start to gather an image of what I may be finding in the abdomen. So like I really love to just kind of check and compare. And also like there's so many fascial connections, and I start to like see like the whole pattern of the whole body when I start that way. And I like to just kind of like guess like, oh, where am I going to find the uterus? Like, and just from the years of doing this work, I would say like 99% of the time I can figure out like
I
what's
remember asking you when I first got on your table, and again, I'm sure everybody's a little bit different, but I'm kind of like I'm the person who asks all the questions during my session. And it was so amazing to kind of hear what your thoughts were when you were, working on my neck and my head, and then to have the same findings,
yeah.
hit the
So,
belly. I was like, oh my goodness.
yeah. Yeah. Yeah, and it just gives us this deeper awareness of how everything is connected. Versus, yeah, like you're right. Some oftentimes in Western medicine, like we'll just look at that one piece when we're actually so much more holistic in mind and body.
Yeah, absolutely. And I think we even kind of went on a tangent too, just with birth work, right? When we're
Yes,
talking about a woman
yes,
who's laboring and has a lot of
yes,
tension in different areas
yes.
of their body, and how that can play such a role in, what's happening in their pelvic floor area.
Yeah, and like you just even like vocalizing and the breath work, that all helps to open up. Where if you're like clenched up here, it's going to clench up so down in your core. So absolutely, that translates a lot to labor and delivery.
Yeah. And can
Mhm.
you kind of just tell our listeners today a little bit more of what is shiatsu and
Oh,
also what
sure.
is moxibustion? I feel like those are two
Yeah.
things that I'm still learning. And I feel like if I was listening today without any knowledge, I would want to know a little bit more about what those mean.
Yeah, absolutely. So shiatsu is based in traditional Chinese medicine. So it's the same meridian system and acupuncture points that acupuncturists use.
Yes.
Same reasons why we would use those particular points, but it's using various types of pressure or massage techniques along those meridians to free up flow
Yeah.
of energy.
Yeah.
Um, and then moxa is an herb that we use over specific points to penetrate deep into that point to have some type of an effect. So, like I might use moxa on somebody's abdomen um, if their uterus is cold. Like
Okay.
that is oftentimes,
Yeah.
or I shouldn't say often, but that is a common finding, is that the uterus will actually be cold. And that
Interesting.
can be for a lot of different reasons, but moxa, along with castor oil packing, will kind of penetrate deep into that tissue and help warm the tissue, also giving it energy. Chi is the word that they use in traditional Chinese medicine, and Maya, it's Chulel. So it's the same concept. There's a lot of crossover actually between Maya medicine and Chinese medicine.
Hey, interesting.
So, yeah. And then you had alluded to that point on the pinky toe. I think it's bladder 67. I'd have to double check.
Yeah.
But it's the last point on the bladder meridian, which when there's a breech baby, that is one of the techniques among many that could be used at the end to help encourage that turn.
Yeah. Amazing. So
Yeah.
much knowledge.
Mhm.
If we could kind of just talk through a little bit, if I am somebody on this journey of trying to conceive, but I've had some troubles, or
Mhm.
kind of just going through each different stage or season of life that some of our listeners might be in, what are different symptoms within those different journeys that you're really able to treat and or help with, whether it be like during pregnancy, maybe some different
Mhm.
symptoms that somebody may be experiencing, or obviously through my own experience with you is my postpartum journey. And I always say, like, it doesn't
Sure.
matter that my twins are 6, like I'm still on this
Yeah,
postpartum journey.
absolutely. Absolutely.
Yeah. So just,
Guys, with an 11-year-old boy. Yes.
it's a new body, lots of
Yep.
changes, lots of different things that have occurred over the last 6 years. And I
Mhm.
also think a part of it too, just my own personal journey, is I now feel like I have some time to really
Mhm.
hone in on my body, right? I'm not
Yeah.
breastfeeding any longer. I don't have a baby on my hip.
Yeah.
Not that I shouldn't have started treating long ago, but I
Yep.
really feel like now I'm in this space and this season of life where I'm like, okay, let's kind of get to know my body, this new body of mine now
Mhm.
post babies.
Yes. Yeah. Yeah. Well, let me speak to fertility first, and we'll kind of go through those stages, knowing that there's so many more.
Yes.
But yes, for fertility, I work with women who have struggled to conceive for a long time, or are thinking about, like, I might want to start conceiving in a couple years and want to get my body ready. Um, so again, because of the way this work impacts the position of the uterus, it could be as simple as flow. Uterus being in the right position, sperm getting where it needs to at the right time of the month.
Yeah.
And that could be it. That could be all that's needed.
Mhm.
For other people, like this work also, and the castor oil packing can impact the uterine tubes. So tubes that have been injured, or I can't remember that dye test that they'll oftentimes do for women on the fertility journey. They might find, like, oh, this tube is blocked for whatever reason. This work can also impact that flow. Every woman is different, but most people that are on a fertility journey come away with this finding of unexplained fertility.
Mhm.
And we're still learning about what that is, whether it's environmental, whether it's chemical, or the food that we eat, hormones. There's so many different elements, but this work does influence our hormones through direct communication between the uterus and the brain, which is a really important aspect of it, freeing up the flow of blood, lymph, chi around these organ systems helps with all of that communication. So with women that come to me for fertility, I like to see them somewhere in their cycle after menstruation and before ovulation, because I don't want to interrupt the flow of a menstrual cycle too much. And also, we want to do this work before, or all the way up to even like implantation time.
Okay.
But after then, we don't want to mess with the uterus,
Yeah.
too much. I can do supportive work during that time. Like it's much lighter.
Okay.
CranioSacral work is really good for that time. So some women that are on their fertility journey might want to see me after they've tried to conceive that month, just to, allow their nervous system to calm down and be more receptive. And I also work with women that are either approaching this on a completely as natural as they can. So like not using interventions like IUIs and IVFs, but I work with plenty of women that are also going through IUI, IVF, surrogacy even. And we just time the work to coincide with that cycle, because sometimes it's interrupted from their natural flow. But yeah, I mean, there are not many studies on the Maya work specifically, but for acupuncture itself, there's, which I don't do, just to clarify, I'm not an acupuncturist, but there are studies that show that doing these types of supportive therapies along with IUI or IVF increases the success rate.
Hey guys, it's Stephanie Sinclair, founder and owner of How To Mom. I'm just interrupting today's episode to make sure you are well aware of all that How To Mom offers. We, of course, are a community and a support group for all moms at all stages of life, but we also offer a large variety of services that I wanted to make sure you are well aware of. We offer birth doula services, both in person or online support. We have birth support groups with different birth packages to choose from. We also provide placenta encapsulation services, lactation services from our lactation counselors. We also offer postpartum services, birth planning assistance, belly casting. We have a registered dietitian, nutritionist. We also offer a variety of photography services from birth, newborn, and family packages. We truly have it all here at How To Mom. So please don't hesitate to reach out today to have a free consult and help us find the best way to support you in your pregnancy, birth, and postpartum journey. Now back to today's episode. Yeah, and just to regulate a cycle. That was my biggest kind of goal with this therapy, aside from decreasing the discomfort I was experiencing, which that was pretty, I have to say that was pretty instant in terms of, feeling so much better with, really breaking that scar tissue up. Yeah, absolutely. But just having some type of, maybe not regular periods, but I mean, there were years and years that there was no cycle at all. And so I feel like that's incredible too. So like you said, even those that are maybe not ready to conceive right now, but they're wanting to really prepare and prep their body and get things aligned. Just that sense of being able to feel so proactive has to be empowering, because I don't feel like that was available to me when Brian and I kind of started thinking. It was kind of like, oh, geez, I'm going to cross my fingers and hope we don't have any issues. And that was like all that was that I felt like was in my toolbox, which is so unfortunate because there's so many things that I could have done now looking back. Okay, so that's incredible. So then what about your clients who are currently pregnant?
Yeah, so I can work with pregnant women at any stage. I do not do direct uterine work for most of the first trimester. But then second and into third trimester, we actually start doing a lot more abdominal work, which is probably my favorite and most rewarding time to work with women, because I really can feel like what's happening, and I can feel baby. It's all very gentle work, but the concept and the intention is the same, of supporting the uterus and working gently with those uterine ligaments. And most women, again, because of our just modern lifestyle, most women's uteruses are a little bit low, and that can impact baby's position. It can impact the pain we feel in our back and our legs, like that, we've got anatomically you have your uterus, or sorry, your bladder, your uterus, and your rectum, and then baby being right, growing low and right in between there impacts digestion, impacts all of that nerve flow into our legs and our low back. So, working gently using both the Maya abdominal therapy techniques and also craniosacral, oftentimes like it's super cool to just like do like a craniosacral hold on, like I'll have one hand underneath the sacrum and one hand like low, just right above the pubic bone, and just feel that craniosacral and like real gentle, like I'm not even moving my hands, but I can feel so much going on. And it's this real gentle, like lifting that occurs. To give you like maybe another example, I saw a client last week for the first time who'd never seen me, and she was 37 weeks pregnant, and she was open to this work, which I asked her about beforehand. I didn't know exactly what she was expecting from, a massage, but she was open to the abdominal work. And I noticed right away that baby was just completely on the right side, head down, but on the right side. And I could just tell by, looking at her initially. And so then, as we're just getting to know her, know each other, I was asking her about baby's position, and sure enough, baby's been over there like the whole time, feels all the kicks on the left. And this was not a long session. It was, especially with the first time seeing her, I didn't want to schedule longer than an hour. I wanted to make sure that, we encompassed all of her pain points. And so this was not a long session, and baby completely shifted to the center, and she was just absolutely amazed, because she's like, I had no idea that I could feel this good at 37 weeks. And not all babies are like that. Like some babies really like kind of find their spot and want to stay there, whether that's for an anatomical reason or that's just something with that baby's journey. But anyways, it was very rewarding to experience like this immediate shift from such gentle work.
Yeah, absolutely. And I think too, just the touch side and the energy side, I feel like in our society, or oftentimes we're like afraid to kind of connect. Like we almost feel like scared, or like, fear is like, okay, just don't touch baby. And I don't know if that sounds crazy, but I just feel like there sometimes is not that connection. And for you to be able to hold space too for these moms who have these beautiful growing babies in their belly, and to really help them kind of connect and become in tune, and also just that gentle touch too. I'm sure babies really enjoy that.
Yes, it's wild how much they move.
Yes, absolutely.
I can feel like either they're like moving because they're exploring new space, or like sometimes they'll just get really like, I can tell they're awake and aware, but they're just kind of like also enjoying or like new experience. Right. Yes.
Who does
and also like a lot of, being pregnant, whether you're supported through your journey and doing it on your own or not, like it's just it's such an individual experience. Like you are the only one that's experiencing this pregnancy at that level. And I just feel like I get like a little bit of a snapshot, a little bit of just like tuning in to like what that woman is experiencing at that moment with her baby. It creates more of a connection, and it's also validating, for a woman to, be told like, I understand why you're feeling this way, or I can feel that too, or just whatever it is.
Yeah. And I will say too, just your energy and the way that you welcome your clients into that space, it felt like such a safe place to be vulnerable, because oftentimes the things that we're talking about aren't always easy, right? Or feeling naive and like not even understanding our own bodies and what's happening. And I just felt like every conversation we have had has been so gentle, so free of judgment, and just really trying to understand what's happening. Because I did kind of feel like I was a little bit of a mess when I first came in, and I'm trying to figure out what's happening with my body, and thinking back to my pregnancies and my births, and all
Yeah.
of those are very vulnerable, raw conversations. And so I just thank you not only for the work that you do with the skills that you have and the knowledge, but also just feeling super comfortable in your space and feeling like I did not feel rushed in the
Mhm.
conversation we had prior to. You really wanted to understand what was happening, what I was feeling, what I was experiencing. And I feel like so much of that, even just in itself,
Mhm.
is incredible for women. And unfortunately, not enough get to experience that. And so thank you for that and allowing me to be very vulnerable as well as one of your clients.
Absolutely. That is one of the most important parts of the session is just it's in Spanish or in Central America, it's called the platica, the talk and the chat, and just like how that's such a healing part of it, and like sharing your journey. And our bodies are our history. And so all of that, it's super normal to feel vulnerable. It's very normal to feel emotional and to feel hesitant. Like most people have never had their belly massaged or touched at all.
I know that's just
And so,
astonishing to think of, like,
yeah,
that never
yes,
happening. And so being able to just experience that is
yep, yep.
great.
And it's always, I hope I communicate this to every client that I have, but it's the work is always under your control. So the pressure, um, if you even want to be touched or not at that time with whatever is coming up, like oftentimes women, this is super natural to even come in right away and just start crying like the first time that they've met me, because they're just like holding all of this, whether it was like recovering from a cesarean delivery and a birth not going the way that they had envisioned, or some type of trauma from any time of their life. Most of that is held in our core.
Yeah.
And so, like, oftentimes as women are like filling out the paperwork, it brings up all of that stuff. And it's kind of like your body's getting ready to release something and you don't know what it is. And you come in and you're talking about, well, this is going on and that's going on. And like, women get emotional.
Yeah.
Perfect.
Yeah, absolutely. And I know
It's
that
a
you
safe
will
place
agree
for that.
with me on this, just with, having the honor of working with so many women and feeling like a safe place for them. Because there are so many that go their entire lifetime without sharing
Mhm.
their frustrations or their trauma or their emotions. And
Mhm.
it is such a true honor to be able to be that person that they trust, and just to breathe some belief that, like, healing can begin, and that
Yes.
you have people out there that not only are available but want to hear your story. Like,
Yes.
it's very, your story is so important. And I know I'm somebody who feels honored and 100% available and open to that and wanting to continue to be in that space. And I know that I even felt that from you. And I know that you also hold that honor and feel this work is so important. This work
Mhm.
is so, so important.
Yep.
Um, and then just lastly, and then I think we'll wrap up. But in terms of postpartum, I can imagine there are a large variety of reasons why women are coming to treat with you. And so it's probably hard to even kind of cover that, just because there's so many different reasons. But at what point in their postpartum journey should they be in contact with you for treatment?
I will see somebody at any point. I've seen somebody the day of, 3 days later, 6 weeks later. So we just modify the work based on what's going on. So, the kind of more direct protocol would be 6 weeks for vaginal delivery, 12 weeks for cesarean. But that is for like
Right.
the whole protocol of work. Like we can do just a few things. We can support your uterus. We can do craniosacral. We can do super light pressure at any point after delivery.
Okay.
And if it's not abdominal work that we're doing, there's a lot of craniosacral that can support, just working on the head and the neck, kind of working with, the upper back and all of the changes that happen, in the rest of our body during that time. So anytime.
Awesome. And I think too, the reason why that is available is because you are very customizable or individual with each um, client that comes to you through not only like your intake form, but the communication prior to them even stepping foot into your space. And so that's incredible. And two, just to lift maybe any fear that anybody may have surrounding this work, just because it's new to them, is it's not something where you go online and schedule and there's not communication prior to it. It was a very, there was a process well before I even laid on your table. And so I want people to know that, to reach out. So what Jennifer and I talked about even prior to recording this episode, because of the work that she does and how she has such a great variety of knowledge and therapies and just experience around body work, is I think we could talk for hours and hours and hours. And so we would love to hear from you guys who are listening today, because Jennifer has been amazing and willing to not only be on the Mom to Mom podcast today, but if you guys have any follow-up questions or would like to learn more about an individual therapy that we touched on today, or individual symptoms, and you want us to go a little bit deeper into those conversations, I know I would love to do it, because I learned a ton of things every time I talk to Jennifer. But she is willing to come on for a follow-up episode. So if you're listening to this right now, please reach out to me, whether it be, through the notes section below or on Instagram or through my website. Let me know the specific questions that you have for Jennifer. And I think it would be so much fun to do that follow-up episode and have her answer those specific questions that you guys may have. So Jennifer, can you tell our listeners how they can get in touch with you, how they can be surrounded by your amazing energy, whether that be kind of on social media or your website, and if you even have availability to see new clients, because you're so skilled, and I know you are in very high demand.
I do have a little bit of a waiting list right now, but please reach out. My website is www.hibiscushealingarts.com. And will you have some show notes that I can include some resources?
I was just going to say, yep, everything that Jennifer is mentioning right now will be listed below, and the links will all be there and available for you and easy to click.
Okay. So, and through that site, you can email me and I can put you on my waiting list. I wouldn't say it's super long right now. I guess it'll just depend on, on how many people reach out. But I always, and especially pregnant women, I will do whatever I can to see you, anybody who needs this work. Or there's a few other people in town also that I can refer to. If I can't see somebody immediately, I might reach out to a couple of other people. Also, if you're fascinated by just the history of this work, this is my favorite book. I don't know if this will come through. This is Sastoon, My Apprenticeship with a Maya Healer, written by my teacher, Rosita Arvigo, and it's all her and her journey with Dona Lihiopanti. It doesn't go as directly into the bodywork abdominal pieces. It's more of just, she's an herbalist and he also is an herbalist, and it's more of like her journey, meeting him, her journey, moving to the country of Belize, and just all of what was involved with that, living in the rainforest. And it's an amazing book. So that would be one fun resource to have. Trying to think of what else I can share. I'll send you some other links, like for castor oil packing, things like that to include.
That's so helpful. Yeah. So our listeners, if you're in the car or on a walk right now, when you have a moment, take a look at our show notes, and we will have all of those links and resources available to you. And I was going to follow up and say, because you are in such high demand, do you have some referrals potentially? And you answered that. So Jennifer, thank you so much for joining us today.
So much.
Thanks for sharing your wisdom, and just thank you so much for the work that you do. I hope you know that you make such a difference in so many people's lives. So thank you.
Thank you so much for having me.
All right, listeners, you have a great day. All right, you guys, that is it for today's episode. I hope you enjoyed. If so, please subscribe to our podcast, comment, share, give us feedback. We'd love to hear from you. Thank you so much for taking time out of your day to listen, and we will see you next time.